Does anyone have any questions? I had a couple questions that were emailed into me before that we can talk about, but if you guys have specific questions for, actually we probably should do introductions. This is usually my moderator's job. So I'm Anne Bowden. I'm a family nurse practitioner at Rising Health. I've been treating Lyme probably since about 2015. I'm an ILADS provider. I was trained with them. Yeah, and this is Dr. Postma, who recently joined us at Rising Health. If you want to talk about your background.
Yeah, so I'm Shawn Postma. I'm a naturopathic physician. Went to Bastyr University up in Seattle. I've been in practice for about 9 years and been studying Lyme since I've been in school. And I've been here at Rising Health for the last 3 months and been absolutely loving it. It's a wonderful clinic and a great team here. And I feel really passionate about helping people with chronic illness and complex illness. And we get a lot of patients that have gone to many different doctors and don't often get the help that they need. And so by the time they come to us, we often have a different lens as far as what we're assessing. And oftentimes, I mean, it might be just because of the nature of our clinic, but we do find a lot of patients with Lyme and mold toxicity and a number of other infections. And so, and we find that we can often help a lot of people once we properly diagnose them. So feel really excited and looking forward to your questions.
Does anybody have a question that you want us to start with? This is kind of an open forum as far as if you guys go to the Q&A, you guys can go in there and type any questions. I can actually start with, I was talking with a patient this week, and she was actually asking me to talk on Lyme disease with kids. And so, and I know this is a question that actually came up when we did our preview for the pre-screening for the new Lyme documentary. And if you guys haven't seen it, I really encourage you to. I did hear it's going to start streaming this month. I'm not sure time, dates, which platform, but I did hear it's coming out here shortly. But so what happened, or what question we get a lot with parents who then are curious about, like, do our kids have Lyme? Is there a possibility of transmission? And when we talk about spirochetes in general, we know they can be sexually transmitted, and we know that they can be transmitted to kids. We know in vet studies that there is some transmission rates. I think it was like an 8% with dog studies. So there is a possibility, right? And we never rule out possibilities. So personally, if someone is not symptomatic, I don't necessarily go straight into treating Lyme disease. The things that we can do to really help these kiddos is to make sure environment's clean. Dr. Postma was talking about mold exposure, mold toxicity that drives down the immune system, actually makes people pretty immunocompromised. Working on kids' guts, right? Diet, lifestyle, those kind of things are always important. Can we do testing? Sure. Can we look at those kind of things? PANS with kids looks a little bit different than traditional Lyme. In Lyme disease, one of the big things that we look at is roaming joint pain. Kids with juvenile reactive arthritis typically is Lyme disease. But PANDAS looks different. So sometimes when we see behavior changes, OCD symptoms, just to kind of be on the lookout for Lyme. It is more of an autoimmune neurological condition, but can be kickstarted by Lyme. If you have anything to add.
Yeah, this is just kind of generally testing, and a lot of patients come in and are telling us that they've been tested by other providers and that they've tested negative. And one thing that I've noticed, and for some of our patients, is that I have had patients test negative initially, and then when we sometimes I'll do like a provoke challenge with some herbs, and we'll actually retest after a month or 2 months, and we'll actually get a a positive. And so it's just kind of one thing to keep in mind as far as testing goes.
Yep, absolutely. I mean, if you have any follow-up questions, you can ask, but we'll kind of move on to the Q&A. So what is the difference between neurological Lyme and Lyme? So can you have neural borreliosis? Yes, you can. What does that mean? There's kind of two answers to that. Can you have spirochetes in your cerebrospinal fluid? The answer is yes. What is it? Ken Ligner actually had a documented case with that. Pretty significant symptoms. Usually when I see neurological Lyme symptoms, seizures are not uncommon. Pretty severe brain fog can kind of go either way that way. But so kind of the difference is just placement, right? Is it in the connective tissue? Is it in the tissues? Or is it in, the brain? And the answer is it can be both. And typically when we see cognitive decline, again, neurological symptoms, nerve pain may be a little bit different than joint pain. Sometimes we pick certain antibiotics that cross the blood-brain barrier, things like Rocephin specifically. We know cross the blood-brain barrier, we don't have to use IV antibiotics. There's lots of antibiotics that do a good job as well. But there's not like this perfect test, right? Unless we, do a cerebral spinal fluid tap, we're not going to necessarily know, is there, spirochetes in the neurologic or in the brain, right? Versus, Lyme, but usually when we talk about neural Lyme, it's more just symptom-based diagnosis, but there is always a possibility.
And I would wonder about like psychiatric related illness and depression kind of falling into that.
Absolutely. Absolutely. I hope that answers your question. So I'm just at the beginning stages of treatment. What does a typical treatment look like? That's probably the hardest question, because it's all based on where you're starting, what your symptoms are. In my world, the more severe the symptoms, probably more aggressive treatment. And under that, treatment for Lyme is not just a one size fits all. Typically, as an ILADS trained provider, it was all about antibiotics. But now we know that lots of herbal antibiotics work just as well, if not better, than traditional antibiotics. And it's really just this conversation you need to have with your provider and what you're comfortable with, because the first thing to do is assess, well, what does your gut look like? Because if we use antibiotics, high probability of causing some problems. And sometimes when we cause more problems in the gut, it's not really helpful. And so it's really just like a conversation, but, treatment can look anywhere from antibiotics, herbal antibiotics, IV antibiotics, disulfiram, SOT therapy. LDI is amazing and I use it all the time. It's not necessarily like a one place to start, but also like what else is going on, right? Like Dr. Postma said earlier, 80% of patients with Lyme disease also have toxic mold exposure. If you have mold exposure, the answer is start there. I think you would echo that sentiment.
Yeah, absolutely. I think other things I think about in regards to treatment is understanding if there are other co-infections, which are pretty likely. And so if we can test for it, that's great. Oftentimes testing doesn't necessarily come back, but I am trying to assess based on symptoms and having that guide our treatment, because sometimes what we choose, whether it's antibiotics or herbals, really helps us to that helps inform our decision making as far as what treatment we choose. So,
and also we love our Lyme patients because they are so educated, and kind of this willingness to walk this path together, because unfortunately, again, Lyme is not it's not doxycycline for 2 weeks. I wish it was. My job would be so much easier. But, we really meet patients where they're at, and start on that. And then also, all the secondary things that we encourage you guys to work on your own. When we talk about biofeedback, heart rate variability, gratitude. I mean, all of these things that you guys can start on your own, to start allowing your body to have some space to heal is very important. Diet and lifestyle changes. All of that is just as important as Lyme treatment. It's really important, actually.
Yep, absolutely.
Yeah. And detox, because that's where we all live, is working on detoxing. The question is, are you familiar with physical treatment or physical therapy for Lyme? Are you familiar at all? So my only real experience with physical therapy specifically for Lyme is actually my patients with Ehlers-Danlos syndrome with Lyme. For some reason, there's a high correlation between the two. I think it's a lot of connective tissue issues in general. And maybe the EDS patients just are a little bit more reactive, and have more symptoms than others. I don't have any recommendations or any specific physical therapy. I have a lot of patients with Lyme who are bedridden that, we talk about cardiac rehab, which has been awesome, especially as symptoms improve and just kind of meeting patients where they're at. We work with health coaches. I think that is really important, again, to kind of start even just little things. I don't have anything specific, and I haven't heard really anything recently in any literature about it.
One thing that did come to mind, I have met with a physical therapist that helps a lot of patients with POTS, and helping to regulate the nervous system a bit more. And that's often a common thing that we see in Lyme disease, where people are getting really lightheaded upon standing and their heart rate is going up. And so I know that indirectly there's other types of physical therapy to really address the nervous system. So,
no, absolutely. So what is SOT? So SOT therapy. So this is so it's a European treatment that actually started originally as a therapy for cancer. And so technically this is messenger RNA. It causes cellular senescence. And all that means is they turns off the cell's ability to replicate. And so this is selective oligonucleotide therapy. And so basically you do have to have a positive test within the last 6 months. We send that test with a blood sample to Greece. They create this treatment that's very specific. It's only for one strain, right? So let's say you have Borrelia burgdorferi, Borrelia miyamotoi, right? It's multiple treatments that you have to do. One, it's not a one for Borrelia in general. It's really strain specific. Success rate, I have seen amazing things with SOT, and I've seen SOT not really help. I think, again, it's just kind of, is it infection? Is it an autoimmune inappropriate reaction? Is it mold underlying that's actually the issue that's suppressing the immune system? I think SOT has very cool possibilities, because there's this possibility that, if this treatment's hanging out for 6 months in the body, there's a potential to turn off all replication of that specific strain of bacteria. Cost is different. So we are one clinic that does SOT therapy. There's actually quite a few SOT providers. We do have to go through training with the lab in Greece. It's like Greece and Switzerland are the two places that, we send the blood to, and then the treatment comes out of the other one. I think there's huge potential. I think that we're still in a little bit of beginning stage of SOT. You can do SOT for viruses. There's some pretty cool data coming out about HIV and SOT use. it's an every 6 month treatment. So it's not curative necessarily with HIV, but I've seen some pretty remarkable things in our clinic. You can use it for Epstein-Barr. I know providers down, not in Utah, but other states that, start with Epstein-Barr actually as their SOT, and they feel like that's been huge. I think to the question about, is there, a correlation between Epstein-Barr and Lyme? Absolutely. I think Epstein-Barr and a lot of these viruses become reactivated when the immune system is overly stressed. And Epstein-Barr on its own is pretty detrimental and can have, significant effects of fatigue on the body. Viruses are a little bit tricky. You can't give an antibiotic to a virus, right? Because it doesn't work that way. And the virus is made up of us. So it's not like it's going to go away anytime soon. But yeah, between the two, which one's stressing which one and which one's making which one worse is kind of the conundrum usually. Any thoughts?
Yeah, I think I often think about the immune system and the health of the immune system when I'm seeing EBV, and how can we generally support the immune system, right, to clear up the whether it's Lyme or EBV or other things that are going on. So
yeah. But definitely correlation, which is why, and again, ILADs trained me, and it's like, here's Lyme that you look for, but here's all the co-infections, and the co-infections are all of the viruses. They're, and mold. And how do you know if you have mold exposure? There's actually some really good testing. Dr. Postma loves real-time labs. I have just used Great Plains. They actually just renamed, I can't remember what their new name is, but Mycotoxin test. Shoemaker's protocol using LabCorp for blood tests, TGF-beta1 specifically is a little bit of a helpful one that you can run. So I typically start with LabCorp just because hopefully I can get insurance to pay for something. And then, depending on symptoms, depending on history, depending on exposure, everyone should be making sure that with this spring melt off that's going to be happening, that we're not having, any water in our basements, because we were actually watching a conference from TFIM, which is a very cool conference that really is like off-label everything, and they kind of just give you your protocols. But they were talking about this medication called Cellcept that is used to suppress the immune system. It's actually made from mycotoxin. So, I mean, if we're talking about a traditional medicine drug that's strong enough to shut off someone's immune system who's getting a kidney transplant, it's, and it's mold toxins. It's pretty significant. So mold is definitely part of this, but multiple ways to test for Lyme, or mold and Lyme both.
yeah, and I think that being said too, what I've learned is that oftentimes what we see on testing is sometimes people's mycotoxin levels are often a bit lower when we initially check. And typically it's like Anne was saying, that it's not only suppressing your immune system, but it can have an impact on shutting down detox pathways. And so what I commonly find is that when we retest, we'll see those levels go up. And if people are out of the mold exposure, and their levels are up, but they feel better, that's usually a good sign that our body is able to dump more of those toxins. And just kind of I think an important thing to keep in mind. And so what I do, at least with real time, and there's different testing strategies, is that I'll help to provoke the mold from coming out of the body. And I'll use glutathione with that. And then I also have people avoid high mold foods up to 3 to 5 days. We want to make sure that it's not coming from your food that you're eating, and it's really coming from your body. And then there's also some recommendations of doing a hot bath or sauna the night before. So sometimes we need and again, this isn't the case for Great Plains. There's different testing methodology, but those are some things that we like to do to encourage or get a more accurate test.
Absolutely. And, symptoms of mold are pretty robust. It's not just like brain fog, right? And does mold cause inflammation in the brain? The answer is yes. But, I see zapping nerve pain a lot of times with mold. I would actually say that that was like the one symptom when I was treating Lyme that wasn't getting better. And then when I started treating mold, that symptom got better. But I mean, I could probably tell you 30 different symptoms that go along with mold exposure. And there's a question in here: what if you can't get out of mold? Can you see success in treating Lyme? The answer is no. I had one patient that every time I saw her, she's super sick. And our conversation was always, how can we get her out of mold? Because if your immune system is shut down, how can we try to fix an infection? And I have just not found that that is the case. So I was kind of skipping around a little bit, just seeing what ones we could group together. So thoughts on colloidal silver IV as treatment. So I've actually done this in the past, and I didn't find that it was amazing. If you had to pick one IV treatment that I find is amazing, it's IV ozone. I would pick that over any other IV treatment out there, especially when paired with UVBI, which is ultraviolet blood irradiation. That would be my favorite, especially along with glutathione, right? Anything we can do again to harness the detoxification. Have you ever used colloidal silver?
Yeah, it was kind of my experience as well. Like, people got some relief. And I've found more success with doing IV ozone. And just as a case example, I had a patient get several months of antibiotics for Lyme and not have any sort of improvement. And one, we tested her for mold, which came back positive, and we're treating that, but also she's been getting IV ozone. And and this is the most success that she has had in her symptoms since starting that. And that's not necessarily comparing colloidal silver, but just kind of a plug for IV ozone that we do see it work.
Mm-hmm. Do you want to answer this one, since it's kind of like from the last one? Other foods that are high in mold besides peanuts?
Anything that is a bit more like porous, so cashews, I think, fall into that category. Anything that's like fermented would fall in that category. Coffee tends to be a really high moldy food, unfortunately, or substance. Those are the kind of the ones that come to mind the most. But
yeah, and I went to a conference. I do pediatrics. And so it was at MedMaps, which is Medical Academy of Pediatrics with Special Needs. And there's like this environmental path that you can do. And it talks about environmental medicine. And it was really kind of eye-opening for me when you think about grains and the potential of grains to have high mold, because if you think about grain silos, well, of course, there's going to be mold in probably the first couple feet, if not more than that. And it's pretty amazing that when it's too moldy for humans, we feed it to animals. And when it's too moldy for animals, we use it to make alcohol. And I've had some mold patients who had actually pretty severe autoimmune reaction to mold, end up having a reaction to really cheap liquor. And we kind of just tied it back to that. So, so I would definitely add to that probably grains, and especially if you don't know the sourcing and where you're getting it from and those kind of things. That's probably the only one that I would add.
Dried fruit, or
yeah,
kind of
totally.
another one. So
totally, yeah. Anything that is hanging out for a long period of time without being eaten, potential for mold for sure. I think we answered the Epstein-Barr virus. Once you have it, you always have it. Yes. Stays dormant. Yes. Tell your immune system. It's kind of like it's cold sore. You just can't see the cold sore with Epstein-Barr. So I have adult son who has Lyme disease and mold toxicity. He's too sick to be in charge of his treatment, and it's been extremely frustrating navigating treatment and watching him not get better. What do you recommend me help him? Anyways, what do you think, Shawn?
Yeah, it is a frustrating process when you see someone really struggling with their health, and I think that if things are really overwhelming, that we really need to try to simplify things and just have a starting place. Um, and there's so many different avenues to take as far as treatment, whether it's mold or Lyme, and um, yeah, and also there's a certain extent where the person has to want to like help themselves, and I know that can be challenging to make that happen, but yeah, I don't know.
Yeah. And sometimes, I would definitely start with mold in detox, because if you don't address that first, Lyme's not going to get better. And actually, before, when I was treating Lyme and actually had no idea about mold, I remember still listening to Shoemaker at an ILADS conference, just being like, wait, what? It blew my mind, because all of these patients that it was like, why aren't they getting better? Why aren't they getting better? And going back to it. So I would start there. Anytime we can improve detox pathways, anytime we can improve the gut, right? Anytime we can improve those things first is always the best place to start. Because not everyone, it's not always Lyme. We see Lyme a lot, we diagnose Lyme a lot, but I've treated mold and people get better. So I would start there. And, gratitude, breathing exercises, biofeedback, all of those things. And then always circling back and asking, what did we miss? Food sensitivities, elimination diet, what else can we do to decrease stress on the body, which is hard. And it's hard to know where to start. But it's most important just to start. So let's see. Do you want to talk about this? I don't know primal trust programming, but brain retraining and vagal toning is pretty amazing.
Yeah, I'm not familiar with that particular program, but I think anytime we can work on the nervous system, I think it's of utmost importance. I know that a lot of people in this field, when we start talking about concurrent issues like Lyme and mold, and sometimes people have SIBO and Candida overgrowth, then the kind of the takeaway that I've gotten around from all of this is that if they're too sensitive, or they're not responding to treatment, the kind of foundational is really working on the nervous system and really helping to retrain how people are responding to stress. And I do something called biofeedback, and a lot of that is that training piece. And what I say is, how can we not get hooked by the stressor? So we're all encountering stressors, and how can we, if we encounter a stressor, how can we move out of it quicker? And I think it plays such a big role in healing, not only for Lyme, but many other things. And, when we're in a fight or flight response, or just a hyper nervous, sympathetic, stressed fight or flight response, that is shutting down our detox pathways. We're not able to digest our food as well. And it just kind of has this downstream effect. So I think it's pivotal to healing and recovery from any sort of chronic illness.
Absolutely. So I had my second SOT about a month ago. I do think it's helped, but I've noticed more GI upset with both treatments. When I talk about SOT with patients, we always talk about what their current symptoms are, because usually what I find happens is where they have symptoms or like what their symptoms are is typically what we see exacerbated with SOT. Now, I've had the question asked, like, Anne, I didn't have any reaction to this SOT treatment. Is it not working? And the answer is no. Actually, most people say that they have no symptoms, and it's just kind of this gradual better. But I have seen mast cell activation start after SOT. I have seen, worsening symptoms. More GI upset would be under the worsening symptoms. Not uncommon. If you think about the GI tract, we're talking about housing 80% of our immune system around our GI tract, because that's our highest exposure to the outside world minus our skin, but we have lots of dead layers. The GI tract is 1 cell thick. And that's a really big deal. And it's how we interact with our environment, right? And we talk about, toxin repositories. The majority of that is within the GI tract. It's a great repository for toxins. And so can you have a higher infection rate in your GI tract? Of course you can. Lyme eats the mucosal layer out of your lining of your gut. So it might just be more of a, hey, where is the Lyme? Versus, SOT actually causing that symptom. Yeah. Let's see. Do you want to do that one?
Sure. So I've gotten great results from ozone treatments. I'm doing them weekly right now. I'm 5 weeks in. What is a typical treatment plan for ozone? When might weekly treatments move to bi-weekly? And is it possible to have increased gut issues with ozone and or mold binders? So, typically with ozone, when we're treating chronic illness, what is typically recommended, at least from my mentors, and this might be even a starting place, is anywhere from 10 to 20 treatments. And I really want to see first if people are responding and having a positive response to those. If people aren't noticing any benefit, then we're not doing the appropriate therapy. So we need to kind of adjust things, or we need to adjust the dosing of the ozone to kind of match the response in the body. And so that's typically the recommendation. And once people start to feel, in my mind, at least like 50% better or more, then we want to, I'm starting to think about spreading that out a little bit more, so it's not as like frequent. And that's just kind of an arbitrary number, but I want to see how people do and how their immune system holds up when we're not on ozone constantly. So that's just kind of the progression that I'll see there. And sometimes we just need a little tune-up every once in a while. I have some people, it's like they'll come in every month, and that's sufficient enough to keep on top of their symptoms and keep them healthy. So
yeah, and the cool thing about IV ozone in general is it increases glutathione production. So the next 3 days after your ozone treatment, your ability to detox exponentially increases, which is pretty amazing. And in my experience, more upfront, spreading it out, kind of the same concept. And even going for 2 passes or 4 passes. Dr. Omar Morales down in Mexico actually gave this great talk of before COVID, so whenever that was. And he actually found less herxing with higher doses of blood. I don't think that is good for everyone, but there is some pretty significant possibilities with ozone. And the cool thing about ozone is it doesn't have to just be IV. I have seen rectal insufflation fix people. I have seen, nasal insufflation, nasal ozone fix chronic sinusitis that people have had forever. I've seen inner ear problems doing the ear insufflation be amazing. We use a lot of ozone for injections, right? Joint injections. We do it for trigger point injections. It's pretty amazing, ozone in general, what it does. And it has this huge capability of decreasing inflammation as well. So huge
I'll add
fans.
to I don't typically see gut related issues with ozone. I've had a couple patients with inflammatory bowel disease like Crohn's. Actually, ozone put their Crohn's into remission. So I've seen a lot of healing qualities to ozone in helping to heal the gut. I often think about other contributors, maybe like binders, causing constipation. It's pulling in more mycotoxins, or it's kind of extra burden that your gut's having to deal with. So that might be more of a contributor.
Yeah, agreed. And especially the kind of binders, cholestyramine is probably the the hardest on people. It's also the strongest cholesterol binder that you can use, which was originally Shoemaker's protocol. But some of those can be definitely hard on the gut, especially if you already have symptoms, GI symptoms. So, all right. So, can Lyme stay dormant? Yes. You know, when we talk about Lyme disease, you know, there's this kind of ongoing conversation in the Lyme community as far as like, when did I get Lyme disease? Because I treat lots of kids and I treat lots of families. Do I think that there's a possibility it was just past? Yes. Do I think that a lot of people have had it for a really long time and they were fine? Dormant, maybe just, hey, immune system was working and it was keeping it at bay and you weren't having symptoms because your immune system was working. So I think that, you know, we talk a lot about remission versus cure, right? If you have no symptoms of Lyme disease, if you're detoxed, if your gut's working, does it matter that you possibly have a couple spirochetes in your body anymore? You probably do. But if we can build up your immune system to the point, it's not necessarily something to, you know, work about. Do we have Lyme in Utah? Yes, we do. There was actually a BYU grad student that was pulling ticks off of, you know, animals in the West Desert and got Lyme disease from being bit by a tick that she pulled off an animal. So it's not just the East Coast. There might be a little bit of transient, you know, what kind of Lyme, which strain of Lyme disease. A lot of doctors don't test for Lyme or mold. Yep. That is that's our experience too. Again, kind of the conversation at the beginning, you know, should you have your kids tested? If they're having symptoms and you have experience and you know, then I would say yes. But that doesn't mean we need to go straight to aggressive therapies with IV antibiotics and all those kind of things. There's lots of things that you can do instead of just traditional antibiotics. And repeat, the best way to treat mold. Shoemaker protocol, you can go to survivingmold.com. It has all of his labs on there that he uses that you can get drawn at LabCorp, real-time labs.
Yeah, you know, a couple things about like Lyme being dormant. I've had some patients be bit by a tick 20, 30 years ago, and you know, it wasn't until they were exposed to some mold or extra stressors where they didn't start to develop symptoms. And so that sometimes we do see that, or at least I've seen that. And I think, again, once we get the immune system healthy again, we should be able to keep it in check and keep it in remission. And so that's just kind of my one comment around Lyme being dormant. And then as far as like just reading the question around testing for mold. So there's ways of testing for mold in your body, but we can also test for mold in the home. And there's a lot of different ways of doing that. My preferred approach is to use, and these all have, I could talk a lot about this, but they all have kind of their pros and cons of the testing. And so there's mold plates, kind of a basic test. What I tell people is if it comes back positive, then we know that maybe we're onto something and we should send it back into the company to be further assessed. If it comes back negative, it doesn't rule out mold. What I tell people is that if mold is on the other side of drywall, for example, we're not going to be seeing those spores. So a mold plate isn't going to necessarily pick up on that. And some spores are really heavy. They don't travel very far. So depending on where you put the plate makes a really big difference. And so there's tests like ERMI and EMA testing, and these are kind of dust collection samples that you can do to check more long-term exposure or even mycotoxins that the mold are excreting. So there's a lot of different ways of testing, and that's a an additional conversation I'm happy to have if anyone's interested.
Yeah, absolutely. And usually I send people to Pure Maintenance to have their house tested. And if their air testing comes back negative, I have them do ERMI testing. Because if I'm seeing pretty significant A symptoms, B, I use a lot of shoemakers labs. I'm usually telling them, go back, it's in your house. I don't know where it's at, but keep looking, and I think the biggest problem is drywall. I mean, it has paper on it, and we're trees in the forest that are covered in mold, and it's like the seeds of mold are already there. Those spores are already in the paper. It's just add water and watch it grow, right? So I think that it's a bigger problem than what we're looking for. And to Dr. Postma's point, if it's behind, between your foundation and that piece of drywall, it can still make you sick. It just you might not pick up on those spores. And I have a personal history of mold exposure, and it's garbage. And it took me a long time, and I'm still kind of mold sensitive, and I test myself once a year, and I am over vigilant about making sure that if I have something going on in my house, that I rip everything out, because it's rough. And detoxing for mold is hard. Kind of circling back to this one too. MS, I have seen MS misdiagnosed, and it's actually Lyme disease. Not always, but I have had patients who we have treated in our clinic. I've read many testimonials of patients who were diagnosed with MS, who were then treated for Lyme disease and had significant improvement, and a few that have no symptoms anymore. Yeah. So I always, our goal as functional medicine providers is to also instill hope in people. We won't stop looking until we figure it out, and we try our best, and we use all of our tools in our toolbox to help people. So keep trying and keep looking. Have you used Darkfield before?
No, but I'm somewhat familiar with it. And I think that there's a lot of subjective, assessment going on with Lyme. I think it's another tool, but I think having I'd like to be able to test in other ways. And we use Vibrant Wellness, there's Hygienics, there's a lot of other testing that we use. And so I like to test doing a blood test to check for Lyme, and not to discredit Darkfield. I just feel like there's a lot of it's up to the practitioner and how experienced they are, and I wouldn't want to be diagnosed with Lyme based solely on that. So
yeah, I agree. And there's more than one kind of spirochete, and so it's hard to say that definitively that's what it is. It's cool though. I don't know if you guys have done Darkfield. It's pretty cool. But I agree with you. I do lots and lots of blood testing. So Dr. Postma does do biofeedback in the clinic, and he's amazing. And I send lots and lots of my patients to him, and it's awesome. And we also do IV ozone in our clinic. Again, probably our number one favorite IV treatment for Lyme is ozone. It's kind of always the backbone. If you have Candida, does it have to be treated successfully before Lyme treatment can be effective? What do you say?
I think it kind of falls in the category of mold to a certain extent, as far as it suppressing the immune system. And so I do like to treat it. And to go back to what Anne was saying, if we do pursue antibiotics, and antibiotics are contributing to Candida overgrowth, it definitely makes our treatment a lot harder. And it can contribute to histamine related issues as well. If Candida is present, which just creates additional inflammation that the body has to deal with, then some really uncomfortable symptoms that people have to deal with as well. So So yeah, I do try to clear it out as much as I can. It doesn't necessarily mean we have to completely eradicate it, but I want to pursue treatment for it, and maybe even concurrently.
Yeah. And in my practice, Candida is a great imitator. I find that a lot of symptoms that people have of Lyme can be Candida. It can cause brain fog, quite frankly, it can cause joint pain. That goes back to diet. What are you eating and what are you feeding it? Because sugar is definitely inflammatory. So I agree. Concurrently is always the best. And again, it goes back to that diet and lifestyle, right? If a Lyme patient comes in, anti-inflammatory diet, right? What can we do just at its basis to make a difference? And usually anti-Candida diets are anti-inflammatory diets. They go hand in hand.
Yeah.
What percentage of patients know they were bit by a tick? Let's see. So I would say a low percentage knows they were actually bit by a tick. Most patients will not get a bullseye rash. There's actually a lot of evidence they're saying between 30 and 40% of people actually do get a rash, versus the other 60 to 70% of patients that don't. Rashes also don't have to look like a bullseye in order to be a Lyme rash. They can be any size, any place, multiple places on the body. Most ticks are the size of the head of a pin. You will never know it. And actually, just last summer, because I'm weird, I saw this bug crawling on me and I was like, that's moving weird. And I pulled it off. I took a picture and it was literally a dot on my thumbnail. But when I took a picture and zoomed in, it was a tick. And actually Borrelia miyamotoi, those ticks are so small, the nymphs, that don't even have to have a first blood, that can infect you. You would never know. They don't have to hang out for days. I think that it's easier to get Lyme disease than we think. And this is our first real winter in Utah in 15 years, maybe even 20. And when animals don't die, ticks don't die. And when ticks don't die, they grow. And I think that we have a lot more Lyme in Utah. But don't be as scared to go out hiking, by the way. Like, hiking in the sunshine and being outside is very important. Just be very aware, right? Like, what can we do to prevent? This is Lyme Awareness Month, right? We're in May, which is actually one of the reasons we're doing this Q&A. What kind of bug spray can we use? Maybe not something with DEET, but something that still works for Lyme. Clothing appropriate. You may have gotten bit by a tick and you have no idea. There are other biting insects that will also transmit Lyme disease, right? Bartonella specifically is also cat scratch fever. It comes from lice and fleas and feral cats, and mosquitoes can transmit babesia. It's not just ticks.
Yeah, I would agree with that. I would say a large percentage of my patients don't ever remember being bit by a tick. A good portion of them hitting, some of them don't remember being bit by a tick, but they grew up on the East Coast. Again, Lyme is present here in Utah, but there are increased risks. And so, being mindful of those risks. And one thing that I want to mention as far as some of those like risks of like being outside and going hiking, I read, I think on the LymeDisease.org site. And one of those was to not lean up against like trees, to have prolonged being seated for like too long in like one place. So there's a couple of things that we can do to kind of minimize that risk.
And dogs, if you're out hiking with your dog, they get into everything. And it's not hard to find ticks on dogs, any animals, right? I mean, that is the purpose of ticks, is to suck blood off of animals. I was going to say something else. No, it's gone. What non-DEET bug spray do you recommend? There's actually lots of them good out there. There's actually lots of essential oils that you can use as well. Geranium specifically. I don't know if you know any special ones. But there's actually quite a few. And actually on Horowitz's website, he actually talks about a couple of them. I can't remember the names right now, but there are actually some pretty amazing tick deterrents out there that are not full of DEET. Do you have any
There's a
specifics?
natural one called the cedar side.
Oh yeah, that one's awesome.
And so from my understanding though, you have to spray it every like couple hours. So it's not something that will be long lasting, like permethrin, like on clothes.
That's cool. Yeah, I can't remember which one Horowitz likes. I bet if you Googled Horowitz and Lyme or ticks deterrent, you'd probably find the one that he uses. It's P something. I can't remember. It's a European brand. What is the difference between SIBO and Candida? Go for it.
So with SIBO, it's stands for small intestinal bacterial overgrowth. So within that name, there'd be kind of a bacterial component and overgrowth in the small intestine, whereas with Candida, it'd be more of a fungal component. They often coexist. We call them frenemies. They like to kind of hang out together. And so how we would treat SIBO would be slightly different than how we would treat Candida. And the treatment is so vast as far as what we could do, whether that's herbals or, with Candida, we might do nystatin or diflucan. So there's a number of things that we can do there. There are some nutrients or herbals that are pretty broad acting. So allicin, for example, can treat both a yeast as well as methane overgrowth. And so that's one that might be helpful. Things like oregano and neem have some antifungal properties as well and can treat SIBO. So,
yeah.
And then diet, I often recommend doing a low FODMAP diet, a low fermentable carbohydrates.
Yep, absolutely. And because we're functional medicine practitioners, it's also like, hey, we did this thing, what happened, right? And we kind of recircle back to that because sometimes, it works for a while and then symptoms come back and then what did we miss, and kind of going back to that. But and SIBO is Candida overgrowth, can also be SIFO, right? So if you ever hear that, small intestinal fungal overgrowth, so definitely some correlation. Did you say Lyme can be cross-generational? There's a possibility. There's no significant research that says yes. But you know what, and I think we might have skipped a question about becoming pregnant with Lyme. I might have missed that one. Sorry if I did. I do have quite a few patients with Lyme that get pregnant, and I do use antibiotics during pregnancy. There's actually quite a few studies on it, that there is this possibility, and we know that the womb is not sterile. There is lots of interaction and placental transmission, and so if you are a Lyme patient and you get pregnant and or multiple miscarriages, Lyme patient, antibiotics during treatment actually is pretty good. And again, there's lots of information. I think is it Terry Jones? Can't remember. There's some pretty amazing midwives that have been treating Lyme patients for a really long time. That's pretty cool. They have some pretty awesome suggestions on there, but I do treat during Lyme or during pregnancy. When I get cold, I have a really, really hard time warming back up. Could this be related to my Lyme mold, etc.? In the heated blanket now. What would you say?
Yeah, well, I think of like thyroid first, and making sure that your thyroid is optimal. I wonder about like iron levels and making sure that those are within optimal. And then, on a kind of, I guess, a deeper level, I wonder about kind of how aggressive the treatment is, and if there's any sort of cytokine like response happening. and the immune system just trying to get some balance. And so those are some a little bit more rare causes, but does come to my mind as far as potential. And histamine too, just again, that's creating a cytokine or inflammatory response there.
Yeah. And definitely with Lyme, you can have intermittent fevers, right? And so it's not uncommon, especially, tick-borne relapsing fever. There's multiple different species that can cause that.
Babesia.
Yeah, for sure, babesia, especially if you're waking up with drenching night sweats, right? Usually we go for babesia. If you're increased anxiety, depression, usually, I go straight for Bartonella first, but decreased circulation can be Bartonella, lacy rashes, pain on the bottom of your feet when you're walking. We kind of put them all under the umbrella of Lyme disease, but they each have a little bit of a different symptomatology. And so those are the kind of things, that's how we pick treatments, right? We have testing that's cool, but is it 100% no? I wish it was, that'd be amazing. But we listen to our patients' stories and what are their symptoms. And from those symptoms is kind of where we pick our treatments. And so, again, Lyme, doxycycline, it's not going to work just doxycycline, maybe with acute, maybe for 6 weeks. I still pair it with something else. But if it's babesia, we're going to want to pick an intercellular antibiotic, something like Aquanel, right? Alinea, any of those kind of things. If it's Bartonella, methylene blue is kind of cool. And azithromycin. And then again, with Lyme, we're going to want to pair it with something else because it is sneaky and it turns from a spirochete into a round body cyst form. So lots of reasons why you're cold. So get all those looked at and then circle back to us and let us know. Do you recommend air purifiers?
From my understanding is that air purifiers and it's a select few can help to filter out spores, but they don't necessarily filter out the mycotoxins that spores are releasing. Those mycotoxins are much smaller, and so I think it can help to kind of pull them out of the air and kind of reduce that irritant. But I think we want to make sure that the underlying cause is addressed.
Yeah, absolutely. And sometimes I have patients who, again, I see families. And so sometimes it's like one family member is maybe sicker than the other. Usually I'm like, well, go get an air purifier and at least have it in your room until you figure out what's going on. I have a lot of patients that, whether they're traveling or away for work for a while or honestly on missions, I'm kind of like pack an air purifier because you really can't control your environment. And if you're already mold sensitive, there can definitely be just kind of almost like an allergic reaction, right? Your immune system's been prepped for mold. You get in a moldy environment. It's not always mold toxins, you're not always toxic from it. But you can definitely become more symptomatic with it.
Yeah, and I've heard about other things too, just to kind of help the home environment. So there's things like home biotics, which are bacteria for your home, which are pretty cool. I haven't experimented with them or have any feedback. But the idea is that, our home has this ecosystem as well as our gut, and we can help to crowd out and protect our home. And there's certain essential oils that can help to kind of keep that in check as well. There's enzymes that can be used to deactivate mycotoxins and spores. So those are some other things that we can do when there's ongoing exposure to mold.
Yeah. Do you have an air purifier that you like?
I usually recommend Austin Air, but there's many others, and I can't think of the ones. Air Doctor, I think I've heard a lot about.
I like Molecule. It's expensive. but it's pretty cool because it will tell you what is in the air. So it's kind of a little bit high tech in that way. And I have some patients that are sensitive to lots of chemical exposure. That actually kind of helps differentiate. It's kind of my favorite, but it is expensive. Anything that kind of combines a really powerful HEPA filter along with maybe UV light. There's some that does microdosing of ozone. You don't want to breathe ozone, by the way. It's not good for your lungs, but microdosing is usually not a problem. My doctor thinks I have dysautonomia from COVID. My daughter had Lyme disease for 6 years. I spent my summers as a child in Lyme country, Connecticut. Is there a chance I don't have dysautonomia instead Lyme? I tested positive on the Western blot.
Tested negative.
Oh, negative. Sorry. If you test positive, that'd be easy. I don't like the Western blot. And if anyone watched the Lyme documentary, there's a huge part of why I don't like the Western blot. They actually took out 2 bands that were pretty specific to Lyme disease. And so it's not a very reliable test. There's better tests. Is dysautonomia a symptom of Lyme disease? Yes, it is. Growing up in Lyme, Connecticut, huge red flag. Kid having Lyme disease, huge red flag. I would get further testing because POTS, dysautonomia are big symptoms of mold exposure and Lyme disease.
Yeah, and what we know is oftentimes COVID can reactivate things that are already there. It just kind of brings them out. And usually what we see underneath that is mold or Lyme or some other things that have been dormant, and it just took this extra stressor to kick the immune system or overboard. And then we'll start to see those symptoms. And so that is just kind of a symptom of something else. And those aren't the only reasons, but those are the kind of the ones that I see most commonly.
Yeah. And Bruce Patterson, who's been doing a lot of the work with COVID long haulers. I think his website is actually covidlonghaulers.com. He has a test, a cytokine test that is actually going through and looking at like, is this COVID? Is this, long haulers, like just kind of looking down the pathways. And actually what he found was exactly what Dr. Postma was saying, is he found, oh, this pathway is a Lyme pathway. Wait, why do they now have Lyme? Well, it's probably a reactivation or a tipping point, right? We talk a lot about tipping points with Lyme disease. Everything's fine. And then you have a death in the family or a divorce or huge accident, right? And now I'm sick. And a lot of times those are just tipping points where the body is just hanging on by a thread and then it's gone and you don't have anything to hold on to. So it is 7 o'clock. And so we're going to wrap up. Not everyone has Herx reactions with antibiotics. And sometimes we treat COVID long haulers the same as we treat Lyme patients. Again, it's looking at underlying and why do they have long haulers. So lots of things that we can help you guys with. I hope this was informational. This is something that Dr. Postma and I are very passionate about. And we love our patients and we love the Lyme community. And, you guys are what keeps us going to conferences all the time and reading new things and listening to podcasts, because our goal is truly to help.
Yeah, thank you so much for joining, and hope you got some good medicine from this. And we're here for you if you want to pursue treatment or if you're already a patient.